Hello everyone, and welcome to our channel. Today's video is a very important educational presentation focusing on a sexually transmitted infection that affects millions of people worldwide every year, yet remains one of the most overlooked and misunderstood diseases in public health discussions. The disease we are talking about today is trichomoniasis. Before we go any further, I kindly ask you to subscribe to our YouTube channel. We create in-depth educational content on health, disease awareness, medical history, and global public health issues. By subscribing, you help us spread accurate information, fight misinformation, and raise awareness that can truly save lives. So please take a moment to subscribe, like this video, and turn on notifications. Now, let us begin. What is trichomoniasis? Basic introduction. Trichomoniasis is a sexually transmitted infection, often abbreviated as an STI, caused not by bacteria or viruses, but by a single-celled parasite known as Trichomonas vaginalis. This microscopic parasite primarily infects the urogenital tract, including the vagina, urethra, and prostate. Unlike many other STIs, trichomoniasis is highly contagious, yet frequently asymptomatic, meaning many infected individuals do not realize they are carrying or spreading the infection. This silent nature makes trichomoniasis a significant global public health concern. Trichomoniasis affects both men and women, but studies show that women are more likely to experience symptoms, while men often carry the parasite with noticeable signs. Historical background of trichomoniasis. The history of trichomoniasis dates back to the early 19th century. The parasite Trichomonas vaginalis was first identified in 1836 by French physician Alfred Donnet using one of the earliest microscopes available at the time. Initially, trichomoniasis was poorly understood and often misdiagnosed as other vaginal infections. For decades, it was not recognized as a sexually transmitted disease. This lack of understanding allowed the infection to spread widely and silently. It was only in the 20th century, with advances in microbiology and parasitology, that trichomoniasis was officially classified as a sexually transmitted infection. Later developments in antimicrobial medications made effective treatment possible, transforming trichomoniasis from a chronic condition into a curable disease. Despite these medical advances, trichomoniasis remains one of the most common non-viral STIs worldwide, largely due to low awareness and underdiagnosis. The parasite, Trichomonas vaginalis. Trichomonas vaginalis is a flagellated protozoan parasite, meaning it uses whip-like structures called flagella to move. This allows it to survive and multiply within the moist environment of the human urogenital tract. The parasite cannot survive for long outside the human body, which means transmission usually requires direct intimate contact. Once inside the body, the parasite attaches to epithelial cells, causing inflammation and irritation. How trichomoniasis spreads. Modes of transmission. Trichomoniasis is primarily transmitted through sexual contact. The main modes of transmission include unprotected vaginal intercourse, genital-to-genital contact, sharing sex toys without proper cleaning or protection. Unlike some infections, trichomoniasis is not commonly transmitted through oral or anal sex, but genital contact remains the primary route. It is important to note that trichomoniasis does not spread through casual contact, does not spread through toilet seats, does not spread through sharing food or clothing. The infection spreads efficiently because many infected individuals do not show symptoms, continuing normal sexual activity without realizing they are infected. Symptoms of trichomoniasis. In women. Women are more likely to experience noticeable symptoms, which may include abnormal vaginal discharge, yellow, green, or frothy, strong or unpleasant vaginal odor, vaginal itching or irritation, pain during urination, discomfort during sexual intercourse. In men. Most men show no symptoms, but when present, symptoms may include mild discharge from the penis, burning sensation during urination, irritation inside the penis. Because symptoms can be mild or absent, regular testing is crucial. Stages and progression. Trichomoniasis does not have clearly defined stages like syphilis, but it can be classified as acute infection, noticeable symptoms, chronic infection, long-term, often asymptomatic carriage. If untreated, the parasite can remain in the body for months or even years, increasing the risk of complications and transmission. Complications and health risks. Although trichomoniasis is curable, untreated infection can lead to serious health problems. In women, increased risk of pelvic inflammatory disease, complications during pregnancy, premature birth, low birth weight infants. In men, prostate inflammation, urethritis. In both genders, increased susceptibility to HIV, increased transmission of other STIs. This makes trichomoniasis not just a minor infection, but a significant risk factor in global sexual health. Global prevalence, countries and regions affected. Trichomoniasis is a global disease, affecting both developed and developing countries. According to the World Health Organization, over 150 million new cases occur annually worldwide. High prevalence regions include Sub-Saharan Africa, South and Southeast Asia, Latin America, parts of the Caribbean, some regions in the United States and Europe. The high prevalence is linked to limited access to healthcare, low awareness, cultural stigma, lack of routine STI screening. Diagnosis and testing. Trichomoniasis is diagnosed through microscopic examination, rapid antigen tests, molecular tests such as PCR. Because many cases are asymptomatic, regular STI screening is strongly recommended, especially for sexually active individuals. Treatment and cure. Trichomoniasis is completely curable. The standard treatment involves metronidazole or tinidazole, taken orally. Treatment is highly effective, affordable, widely available. Sexual partners must be treated simultaneously to prevent reinfection. How to prevent trichomoniasis. Prevention strategies include correct and consistent condom use, limiting number of sexual partners, regular STI testing, avoiding unprotected sex, treating all sexual partners. Education and communication between partners are key. Protection and personal safety. Protecting yourself means being informed, getting tested regularly, seeking medical care without shame, practicing safe sex. Awareness leads to prevention. Social stigma and awareness. Trichomoniasis is often ignored due to stigma surrounding sexual health. This silence delays diagnosis, increases spread, increases complications. Open discussion and education are essential to breaking this cycle. Why awareness matters today. Despite being curable, trichomoniasis continues to spread because many people have no symptoms. Many people are never tested. Awareness is low. Knowledge is the first line of defense. Final message and strong subscribe call. If this video helped you understand trichomoniasis better, please subscribe to our YouTube channel right now. By subscribing, you support educational content, help spread health awareness, help protect communities, help fight misinformation. Subscribe, like, share, and comment. Your support helps this message reach those who need it most. Thank you for watching. Stay informed, stay safe, stay healthy.